Dear students, today we are going to discuss about the immunocomplex mediated MPGN, membranoproliferative glomerulonephritis. If we talk about the disease, this disease is basically most common cause of the end-stage renal disease. The disease is most prevalent in the childhood or in young adulthood. If we do classify the disease may be idiopathic or the disease may be of some causes. So there may be some secondary causes. If we talk about the pathogenesis, so what happens? The antigen and antibody complexes are formed in situ in glomerulus or may be formed in the circulation and deposited in the glomerulus. So what happens? There is the inflammatory response, and this inflammatory response leads to activation of the complement, and this activation of the complement will lead to disruption of the glomerular basement membrane, and this disruption of the glomerular basement membrane will lead to endocapillary proliferation. So this is the pathogenesis. What is pathogenesis? Pathogenesis means antigen antibody complex formation either in situ or outside, means in the circulation, can be deposited in the glomerulus. What happens? There is the inflammatory response. Inflammatory response will activate the complements. The complements activation will lead to disruption of the glomerular basement membrane, and this glomerular basement membrane will lead to endocapillary proliferation. So this is the pathogenesis basically in brief. But if we do the kidney biopsy and we talk about the pathology, in light microscopy, what we see? In light microscopy, basically we see the endocapillary and mesangial proliferation. We see the endocapillary and mesangial proliferation, and this gives the lobular appearance to the glomerulus. Lobular appearance to the glomerulus, and this capillary wall looks like a tram track, and the capillary wall looks like a tram track because of the duplication of the basement membrane or doubling of the basement membrane. So doubling of the basement membrane looks like a tram track. So capillary wall tram track appearance is usually found because of the duplication of the basement membrane. So these are basically seen on light microscopy. If we do the immunofluorescence, so basically in glomerulus in glomerular basement membrane and mesangium, we see the deposition of the IgG and complements. So the deposition of the IgG and complements in the glomerular basement membrane and in mesangium is usually seen in immunofluorescence. If we see the electron microscopy is suggestive of electron dense deposits. So this is the pathology. If we do the biopsy and we talk about the pathology, so these are the findings basically we find in the immunocomplex mediated MPGN. Now the clinical features. If we talk about the clinical features, so the patient may present with acute or chronic glomerulonephritis, may present with a hypertension, may present with the edema, may present with a microscopic hematuria, or may present with the subnephrotic range proteinuria, or patient may present with the CKD. Either of this presentation may be there. So if we talk about the clinical feature, if we talk about the clinical feature, the patient may present with the acute oblique chronic glomerulonephritis, hypertension, edema, microscopic hematuria, subnephrotic proteinuria, and chronic kidney disease. Now the workup. If we do the workup, so basically when we do the basic labs, what we see the rise of the creatinine, there is a microscopic hematuria, there is proteinuria, complements are low, C3 and C4 are low. But if we find out the secondary causes, so we are supposed to find out the hepatitis C virus, hepatitis B virus, we are supposed to find out the endocarditis, we are supposed to find out the shunt nephritis, we are supposed to find out the abscesses, mycoplasma, etc. we are supposed to find out. So shunt infection, basically not shunt nephritis. So we are supposed to find out the shunt infection. And if we talk about the autoimmune disease, then we are supposed to find out the Sjogren, SLE, rheumatoid arthritis, connective tissue disorders. We are supposed to find out. If we talk about the hematological conditions, so we are supposed to find out the monoclonal gammopathy, we are supposed to find out the lymphoproliferative disorders, multiple myeloma, etc. We are supposed to find out. Now, if we talk about the treatment is basically the first of all the conservative treatment, the BP control. We are supposed to do the RAS block. We are supposed to treat the underlying cause. We are supposed to if the disease presents with the RPA gene, then we are supposed to give the immunosuppression like rituximab, steroids, etc. We are supposed to give. So this is about the immunocomplex mediated MPGN in short.